Good day, everyone. My name is Rutuklesha, and I'll be the one conducting the mini workshop for COVID-19 training. When we're done with the training, you'll be able to know what is COVID-19, what stages and symptoms when you have COVID-19 disease. You will be able to know how to treat, or let me say, how to manage COVID-19, because there's no cure yet for COVID-19. You'll be able to know the recent statistics of COVID-19, the people that have recovered from COVID-19 and the deaths of COVID-19 with people that have COVID-19. You'll be able to know how to prevent COVID-19. You'll be able to know you'll be able to know how to treat it. Yes, I already said that. Okay, let me start with what is COVID-19. COVID-19 is the coronaviruses, a large family of viruses that cause respiratory illness, ranging from the common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. Coronaviruses are zoonotic, meaning that they are transmitted between people and animals. From animals to people. The coronavirus disease is an infectious disease caused by a new strain of coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, in China, in 2019 December. Maybe that's why they call it COVID-19. I wish we could understand that no one wants to get coronavirus. You shouldn't feel sad or any pain when you have coronavirus, because anyone, anytime can get coronavirus. It's not like HIV and AIDS or like diseases that you ought to be blamed for. Do you understand? Let us go for stages and symptoms of coronavirus, of COVID-19 infection. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are flu, fever, dry cough, tiredness. Less common symptoms are pains and aches, sore throat, diarrhea, conjunctivitis, and headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. Serious symptoms are difficulty with breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days for the symptoms to show up. How to prevent COVID-19 transmission. Protect yourself and others from the spread of COVID-19 so that you can reduce your chances of being infected or spreading COVID-19 by taking some precautions, such as regularly and thoroughly clean your hands with an alcohol-based hand rub, or wash them with soap and water. Washing your hands with soap and water or using alcohol-based hand rub kills virus that may be on your hands. If you can use an alcohol-based sanitizer, make sure you use and store it carefully. Keep alcohol-based hand sanitizer out of reach of children. Teach them how to apply the hand sanitizer and monitor its use Apply a coin-sized amount on your hands. There is no need to use a large amount of the product. Avoid touching your eyes, mouth, and ears and nose immediately after using an alcohol-based sanitizer, as it can cause irritation. Hand sanitizer recommended to protect against COVID-19 are alcohol-based and therefore can be flammable. Do not use before handling fire or cooking. Under no circumstances, drink or let children swallow an alcohol-based sanitizer. It can be poisonous. Maintain at least 1 meter distance between yourself and others, because when someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth, which may contain a virus. If you are too close, you can breathe on the droplets, including the COVID-19 virus, if the person has the disease. That's why you need to be very careful. Avoid going to crowded places. Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19. And it is more difficult to maintain physical distance of 1 meter in a crowded space. Avoid touching eyes, nose, mouth, because hands touch many surfaces and can pick up virus. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and infect you. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth with with your band, elbow, or tissue when you cough or sneeze around people, even if you are alone. And then dispose of the used tissue immediately. And wash your hands. Droplets spread virus. By following good respiratory hygiene, you protect the people around you with virus such as cold, flu, and COVID-19. Stay home and self-isolate even with minor symptoms such as cough, headache, mild fever until we recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. Avoiding contact with others will protect them from possible COVID-19 and other viruses. If you have fever, cough, difficulty with breathing, seek medical attention immediately. But call by telephone in advance if possible and follow the directions of your local health authority. National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your health care provider to quickly direct you to the right health facility. Calling in advance will allow your health care provider to quickly direct you to the right health facility. This will also protect you and help prevent the spread of viruses and other infections. Keep up to date with the latest information of COVID-19. And you should have a healthy lifestyle. The COVID-19 pandemic means that many of us are staying at home and sitting down more than that we usually do. It is hard for a lot of us to do the sort of exercise we normally do. It is even harder for people who do not usually do a lot of physical exercises. But at a time like this, it is very important for people of all ages and abilities to be as active as possible. It is very important to be active at this point in time. Taking a short break from seating by doing 3 to 4 minutes of light intensity physical movement, such as walking or stretching, will help ease your muscles and improve blood circulation and muscle activity. Regular physical activity benefits both the body and mind. It can reduce a high blood pressure, help manage weight and reduce the risk of heart disease, stroke, type 2 diabetes, and various cancers, all conditions that can increase susceptibility to COVID-19. It also improves bone and muscle strength and increased balance, flexibility, and fitness. For older people, activities that improve balance help to prevent falls and injuries. Regular physical activity can help give our days a routine and be a way to stay in contact with family and friends. It can also be good for mental health, reducing the risk of depression, cognitive decline, delay the onset of dementia, and improve overall feelings. Having a healthy diet. Eating healthy is very important during COVID-19 pandemic. What we eat and drink can affect our body's ability to prevent, fight, and recover from infections. While no foods or dietary supplements can prevent or cure COVID-19 infection, healthy diets are important for supporting the immune system. Good nutrition can also reduce the likelihood of developing other health problems, including obesity, heart disease, diabetes, and some types of cancer. For babies, a healthy diet means exclusive breastfeeding in the first 6 months with the introduction of nutrition and safe foods to complement breast milk from age 6 months to 2 years and beyond. For young children, a healthy and a balanced diet is essential for growth and development. For older people, it can help to ensure healthier and more active life. Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help protect against many common childhood illnesses. Babies should be breastfed exclusively during the first 6 months of life, as breast milk provides all the nutrients and fluids they need. Women with COVID-19 can breastfeed if they wish to do so and should take infection prevention and control measures. Tips on maintaining a healthy diet. Eat a variety of food, including including fruits and vegetables. Every day, eat a mix of whole grains like wheat, maize, and rice and legumes, lentils, beans, and plenty of fresh fruit and vegetables, with some foods from animals like milk, eggs, and meat. Choose whole grain food like unprocessed maize, millets, oats, wheat, and brown rice. When you can, they are rich with valuable fiber and can help you feel full for longer. For snacks, choose raw vegetables or fresh fruit and unsalted nuts. Cut back on salt. Limit salt intake, like 5 grams. It's equivalent to a teaspoon a day. When cooking and preparing for food, use salt and reduce the use of salty sauces and condiments like soya sauce, stock, or fish sauce. If using canned or dried food, choose varieties of vegetables, nuts, and fruit without added salt or sugar. Remove the salt shaker from the table and experiment with fresh or dried herbs and spices for added flavor in your meal instead. Check the labels on food and choose products with lower sodium content. Eat moderate amounts of fats and oils. Replace butter with healthier fats like olive, soy, or corn oil when cooking. Choose white meals like poultry and fish, which are generally lower in fats than red red meat. Trim meat of visible fat and limit the consumption of processed meats. Select low fat or reduced fat versions of milk and dairy products. Avoid processed, baked, and fried foods that contain industrially produced trans fat. Try steaming or boiling instead of frying food. Frying food when cooking. Limit your sugar intake. Limit intake of sweets and sugary drinks such as fizzy drinks, fruit juice, liquid and powder concentrates like and energy drinks and coffee. Choose fresh fruits instead of sweet snack such as cookies, cakes, and chocolate when other dessert options are chosen. Ensure that they are low in sugar and consume small portion. Avoid giving sugary food to children. Salt and sugars should not be added to complementary foods given to children under 2 years of age and should be limited beyond that age. Stay hydrated at all times, drinking lots of water. Good hydration is crucial for optimal health. Whenever available and safe for consumption, tap water is the healthiest and the cheapest drink ever. Drink water instead of sugar, sweetened beverages is a simple way to limit your intake of sugar and excess calories. Avoid harmful alcohol use. Alcohol is not part of a healthy diet. Not at all. Drinking alcohol does not protect against COVID-19 and can be very dangerous. Frequent or excessive alcohol consumption increases your immediate risk of injury, as well as causing longer-term effects like liver damage, cancer, heart diseases, and mental illnesses. There is no safe level of alcohol consumption. Quitting tobacco. Quitting tobacco. Smokers have a high risk of getting coronavirus because they are constantly putting their hands to their lips. And then if they get coronavirus, they run a greater risk of getting severe case because their lung function is impaired. Quit today so that you can reduce the risk and start living a healthier life. Tips to curb your cravings. Delay as long as you can before giving it to your edge. Deep breathing. Take 10 deep breaths to relax yourself from within until the edge passes. Drink water. Drinking water is a healthy alternative to sticking a cigarette in your mouth. Do something else to distract yourself, like taking a shower, a walk, reading a book or newspaper, or doing some exercises, or getting a new hobby like cooking and etc. There are many resources within your own community. Find out if your healthcare providers with your healthcare providers, quit line counselors, cessation programs are available to support in your journey of quitting tobacco. Let us go to what to do when you're infected with COVID-19. Self-isolation is an important measure taken by those who have COVID-19 symptoms to avoid infecting others in the community, including family members. Self-isolation is when a person who is experiencing fever, cough, or other COVID-19 symptoms stays at home and does not go to work, school, or public places. This can be voluntary or based on his or her health care provider's recommendation. When you attend the health facility, wear a mask if possible. Keep at least 1 meter distant from other people. and do not touch surfaces with your hands. If it is a child who is sick, help the child stick to the advice. Must have well ventilated with hand hygiene and toilet facilities. If it is possible, place the beds at least 1 meter away from each other. Keep at least 1 meter from others, even from your family members. Monitor your symptoms daily. Isolate for 14 days, even if you feel healthy. When you develop difficulty with breathing, contact your healthcare provider immediately. Call them first if possible. Stay positive and energized by keeping in touch with your loved ones by phone or online, by exercising yourself at home. Positivity can do so many things. Being positive can help you recover this disease. What is the difference between quarantine and self-isolation? Quarantine means restricting activities or separating people who are not ill themselves but may have been exposed to COVID-19. The goal is to prevent the spread of the disease at the time when people just develop symptoms. Isolation means separating people who are ill with symptoms of COVID-19 and may be infectious to prevent the spread of the disease. Physical distancing means being physically apart. This is the general measure that everyone should take, even if they are well, with no unknown exposure to COVID-19. And we're going to talk about what is COVID-19, how to treat COVID-19, or let me say, how to manage COVID-19, because there's no cure yet for COVID-19. There is no specific treatment available for COVID-19. Treatment is supportive, for an example, providing oxygen for patients with shortness of breath or managing the fever. Antibiotics do not treat a viral infection. However, antibiotics may be required if a secondary bacterial infection develops. Currently, there is a vaccine being developed. To date, there are no specific vaccines or medicines for COVID-19. Treatments are under investigation and will be tested through clinical trials. Self-care. If you feel sick, you should rest, drink a lot of water, or a lot of fluids, and eat nutritious food. Stay in a separate room from other family members and use a dedicated bathroom if possible. Clean and disinfect frequently touched surfaces. Everyone should keep a healthy lifestyle at home. Maintain a healthy diet, sleep, stay active, and make social contact with the loved ones through the phone or internet. Children need extra love and attention from adults during this difficult time. Keep to regular routines and schedules as much as possible. It is normal to feel sad, stressed, or confused during a crisis. Talking to people you trust, such as family or friends, can help. If you feel overwhelmed, talk to a counselor or a health worker. Medication to manage COVID-19. The aim of the treatment is to manage and reduce symptoms until you have recovered. Most people, around 80%, have an asymptomatic or mild infection, which can be treated at home. In this case, you should self-isolate for at least a week until you have recovered. One in five people who contract COVID-19 will require hospital care. Around 15% of cases experience a severe infection requiring oxygen to help with respiratory symptoms. 50% experience critical infections requiring ventilation. Those at a higher risk of severe or critical infection including older people and those with underlying health conditions. Painkillers for most viral infections, including flu and the common cold, simple painkillers such as paradectamol, such as ibuprofen are widely recommended by the doctors, by health care workers. The UK's Commission on Human Medicines drew up an urgent expert working group to look at the evidence. On the 14th of April, they published guidance stating that there is currently an insufficient evidence to establish a link between use of ibuprofen or other non-steroidal anti-inflammatory drugs, which is NSAID, and susceptibility to contracting COVID-19 or worsening of its symptoms. Patients can take paradectamol or ibuprofen when self-medicating for symptoms of COVID-19, such as fever and headache, and should follow advice from their medical doctors. Other symptoms. Some of the medication and treatments you might use to treat colds and flu will also help with coronavirus symptoms. Cough medicines or cough suppressants can help reduce your cough, throat, and remedies like honey and lemon improve a sore throat. Antibiotics. If you have antibiotics lying around at home, do not take them to treat coronavirus, as it is a virus. Antibiotics will improve coronavirus. You should never take antibiotics which haven't been prescribed for a certain condition. Antibacterial hand washes, cleaning products, and hand sanitizers also won't be effective in killing the virus on surfaces or your hands for the same reasons. Traditional remedies. There are many traditional cures and herbal remedies ideas floating around the internet and in health stores. Currently, we aren't aware of any remedy to cure COVID-19, so don't be fooled by the miracle treatments some people are trying to sell to us. When to seek medical attention, if your illness is worsening or your symptoms haven't improved after 7 days, you should seek medical attention immediately, as soon as possible. Even under the new measures announced by the government to prevent people from leaving their homes for non-essential purposes, you are still able to seek medical care of all kinds. You should not see your GP or pharmacist if you think you might have coronavirus. Any routine medical or dental appointments, should you had previously booked, should normally be cancelled whilst you are sick at home. If you are asked to attend whilst isolating or you have concerns, call the practice or a hospital first before going in there. Lastly, we're going to talk about the statistics, the recent statistics, which were published on the 27th of July 2020. And the total number of tests conducted to date is 2,802,211, with 28,433 new tests conducted since the last report. Reported deaths and recoveries. Regrettably, we report 298 new COVID-19 related deaths, 77 from Eastern Cape, 61 from Gauteng, 9 from KwaZulu-Natal, 36 from Western Cape, 13 from Mpumalanga, 91 from Free State, and 11 from Northwest. This brings the cumulative number of deaths to 7,067.